Hi, hello, namaste. This is Shravya. Present, I am in Attapur Germanten Hospital, best orthopedic multi-specialty hospital. So today, present with us Dr. Abdul Qayyum Quadri, general physician. Hello, sir.
Hello.
Sir, nowadays so many people are facing about viral fevers. Actually, what is the meaning of viral fevers? There are so many types of viral fevers. What are they?
Well, virus is a microorganism which we cannot see with the naked eyes. Uh, these viruses are various categories and they can affect various systems in our body. Like if they can affect the respiratory tract system, they can affect the gastrointestinal system, that is the digestive system,
Hmm.
and they can affect the liver, where they can cause hepatitis, and they can affect the blood system also, where they reduce the platelets, and they can affect the skeletal system or the joints.
Hmm.
At the same time, all these things they come with fevers. This is the simple, based on the system that is getting affected, you can classify this way. So in this, the most common is the flu virus, which affect the respiratory tract system, causing upper respiratory tract infections, where the symptoms will be like fever, repeated sneezing, cough, fatigueness, and throat congestion, nasal blockage. These are the common symptoms that you get with flu disease or viruses affecting the respiratory system. Then you have dengue fever, which is transmitted through mosquito.
Hmm.
This usually causes fever, sometimes rashes, body aches, and the changes that happens in the blood is the platelets comes down, and the white blood cells also comes down. These are a common thing. Sometimes it causes very serious and complicated problem, like there may be bleeding inside, and there will be severe loss of fluids into the cavities of the body, like the abdominal cavity or the lung cavity. Such cases, it can be fatal also. Then you have chikungunya, which affects the joints mostly, and with that it causes fever and joint pains. Hmm. And swelling of the joints. Then the viruses that affects the liver commonly causes jaundice, hepatitis, where the enzymes rises. The common is hepatitis A, which usually subsides or self-limiting disease. It starts as a upper respiratory tract fever and upper respiratory tract infection symptoms. Then after the fever subsides, then there can be nausea, vomiting, and fever takes uh, over. So this also gets it's a self-limiting disease. Over a period of time, week to 10 days, 14 days, it patient recovers by themselves. Okay, and there can be gastrointestinal system getting affected, where you get gastritis, gastroenteritis, diarrheas, vomitings because of gastric irritation. This usually happens through if you consume contaminated food, especially outside food in restaurants, or food which has not been prepared in a very sanitary or hygienic way.
Hmm. Sir, what are the symptoms of dengue fever?
Dengue fever, dengue mostly starts as a febrile illness. Patient gets fever, which can be high grade. They get easily fatigued, and there can be rashes sometime on the body. And then usually it's the high grade fever that brings the patient to the hospital. Sometimes they get nausea and vomiting also. And once to diagnose this, whether it is dengue or not, the best initial test is NS1, dengue NS1 serology. If NS1 earliest within a day or two also of fever, also this can get picked up by a card test, which is a very simple test. A small 1 or 2 ml of blood sample is taken and it is tested. Once diagnosed, the treatment is usually supportive treatment. Supportive, by supportive means there can be like fever, so you have to give medicines to reduce the fever, and there will be dehydration because of fluid getting lost into the spaces of the body, like peritoneum or lung cavities. For that you just have to hydrate the patient. If there is no vomitings, if patient is tolerating orally well, you can just allow them to take as much of oral fluids as possible by way of coconut water, plain water, or ORS. So this is about hydration status. And then monitoring has to be done. Like the most important problem that we come across is fall in platelet levels. So that has to be monitored. The normal level of platelet is 1.5 to 4.5 lakhs per cubic millimeter, but it can fall from 1.5 down to, it can go down to maybe 10,000 also. But whether you have to worry at all levels of platelet fall, no. Only if the platelets comes down below 20,000 or 15,000 per cubic meter, then only there is a chance of spontaneous bleeding taking place. So at that time you have to worry and replace or transfuse platelets externally to the patient. Till that point of time, you have to just patiently wait, and we don't have to get panicky also. And for other measures to improve platelets, usually they say some fruits like kiwis or papayas, they helps in improving the platelet levels, but there is no hard evidence for that. And some papaya extract pills are available, which are being used commonly in medical practice. Once the fever subsides, and without the use of medicine, if the patient is remaining to be without fever, within 12 to 24 hours of that period, platelet starts to show improvement. Okay, so we have to monitor till it returns back to more than 100,000 per cubic millimeter.
Sir, what are the medications and tests that patients should take?
Initially, you have to get a complete blood picture done, and dengue serology, that is NS1, and IgG and IgM, dengue IgG, IgM. So these are the tests that is, and then systemic tests like liver function test, renal or kidney function test, just to know whether, because sometimes these dengue viruses can affect the liver also, just to see whether the liver enzymes are going up or not. For that, you have to check liver function test and kidney function.
Okay. Sir, I got wondered. Whatever may be the fever, they don't know they use paracetamol. Is that correct way?
Yeah, first and foremost thing to be done is to reduce the fever. Most of the time, these are viral fevers. You don't have to jump to antibiotics the moment you get fever. So paracetamol is the first line of treatment. You have to take paracetamol. Usually, if it is a flu-like disease, within 2 to 3 days, patient recovers. You don't have to take antibiotics. Just symptomatic treatment to reduce the fever. And keeping yourself well hydrated by way of consuming lot of fluids.
Yes, sir. Well explained. Thank you so much.
Welcome.